Today's episode of This Week in Startups is brought to you by InVision. Find out why so many hot startups are using InVision to prototype, present, and collaborate on design in real time. Sign up for a 90-day free trial today at invisionapp.com/twist. And by Audible.com, a leading provider of spoken audio information and entertainment. Listen to audiobooks whenever and wherever you want. Visit audible.com/twist for your free audiobook. And by AWS Activate, the Amazon Web Services startup program. It's easy to start and scale your business with AWS. Visit aws.amazon.com/activate.
That's what it's all about, man. They said, money is the root of all evil. What? Funny how it feeds my people. Yeah. We ain't gonna live like equals until we get the money, spend the money, and defeat you. Yeah. Money is the root of all evil. What? Funny how it feeds my people. Yeah. We ain't gonna live like equals until we get the money, spend the money, and defeat you.
Hey everybody, welcome to This Week in Startups. I'm your host, Jason Calacanis. If you haven't watched the program before, well, pretty simple. We talk about a new startup company each week, and sometimes we'll talk to an investor or two, and basically try to look at where the world is going through the lens of the entrepreneurs who are creating the products and services that will define the future. And today on the program, Geoff Clapp is with us. He's a tremendous entrepreneur who also is a super fan of the show. He's been watching the show for a long time, and he's on the back channel with us at twistlist.co, where we all talk about the show in the background. But he created an app that I can tell you right now is one of my top 5 favorite apps. It's called Better. Go to the App Store right now and download it. And Better is, I think, a revolution, Geoff. You know I'm in love with the product. And it's not because I know you previously from the show and the back channel.
Right.
It's because I actually do use it, and you see that I use it, I guess.
Yeah. I mean, obviously, from a patient privacy standpoint, I don't see what you do.
Yes.
But I mean, I do know that you use it, which is a great endorsement. I mean, all we care about is actually helping people and having them use product. I mean, one of the things I think I've learned, not just from the back channel, but my career, is show, don't tell. You say that all the time.
Yeah, show, don't tell.
And
product speaks.
Yeah, so why talk about slides when people are actually using it? Right?
Exactly. All right, so here we go. Load the product. Let's show the product
let's do it.
Yeah.
So.
And I've been using the product while you get loaded there for about a year or more, and it has changed my life. So here we go.
Yeah, so
we're looking at the app, and the app says Crystal, S.
Yeah, so Crystal is a personal health assistant. And what we are is a personal health assistant service. And so what you're looking at here is, this is my stream. This is actually from earlier today. I use the product also, which I think is really important.
Pretty good as the founder and CEO.
Yeah, I think there's a lot of stuff that people build because they think other people need it, right? And so this is something I want the world to be this way. So I use the product. Right. So this is what you're seeing here is literally a chat interface with a person who's assigned to me, Crystal, who's my personal health assistant.
And this looks like, Yammer or Slack or HipChat.
Absolutely. And those are good. People know those metaphors, right? They know Apple messaging. They know those metaphors.
It does look like Apple messaging too.
Yeah. There's no reason to make it hard on people, right? What are the metaphors they know, right? So we chose a chat interface as the main interface that you use to talk to your personal health assistant. Now, of course, I've already signed up. I've been assigned someone. They know a little bit about me, including, for instance, my insurance and things like that. Our office is in Palo Alto. I asked her, I said, hey, I need a dentist. This is true.
Yeah.
I need a dentist. It's before the end of the year. Oops, I went to sleep there.
No problem.
I want a dentist.
Now you all know your passcode.
Yeah. Anybody steals my phone.
Let's cut that out of the show.
Sorry, there's not that much worth on there. If somebody wants to use the product, they can just download it. Yeah. So then you got...
so here you asked for that, and she says, Dr. Eric Kwan on Middlefield Road. Yeah. Here's the health grades, here's Yelp, and we'll see you and your daughter open Saturdays.
Yeah, so the big thing was I said, in my profile is my insurance information already, all that stuff, right? So I've already loaded up things like my daughter and my grandmother, right? So one of the things I also get is information from our partner, the Mayo Clinic. My grandmother this year, going through dementia and Alzheimer's, and
I'm sorry, my grandmother went through it too. Yeah.
Went into home, and so these are real articles that I was getting because I'm caregiving for someone. This is something as my family's going through this. So this person's not only providing the administrative support, but I'm actually getting information that's both clinical about things that my daughter's going through as she goes through puberty and ages, but also my grandmother as she ages as well.
So I put my 5-year-old in. I have my wife on it now too.
Yep.
So you will tell us, hey, as a 5-year-old, you're going to need to think about these vaccines or shots or whatever, and you'll be proactive in doing that.
Exactly. I think the key thing about healthcare, and we get into like why we started the company, the key thing is healthcare kind of sits back and waits for you to come to it.
Right.
And I think that's one of the biggest problems with healthcare. And
it's passivity.
Exactly.
Why is it passive? Why is healthcare passive? Because they don't want to spend money? They don't want to incentivize you to rack up the bills?
You know, I think one of the things is that healthcare is so old. And it is something where we just don't know how to make it active, and it's slow to adopt technology. Let's talk about, like, for your daughter, for example. Yeah. When you moved recently to San Francisco.
Correct.
Right? I think most people that watch the show know that.
Yes.
Right around the time you moved, there's this whooping cough outbreak in Marin County, right?
Oh, wow.
If your kids are around 9, 10, 11, that vaccine they got when they were younger is actually lapsing. So I've been in healthcare forever, right? Yeah. Or at least seems like forever.
Yeah.
I don't know that, right? So my PHA is telling me, hey, Geoff, your daughter's 9. Marin County's not that far away. You need to know about this. I've already checked. Mackenzie, we should update her vaccination.
Right.
Here are the dates of the appointment. All I got to do is say yes.
Right.
Right. And it's all taken care of.
Right. All that stuff of picking up, because I find that the friction of trying to find a doctor in my network and all this stuff is so great that you only do it when you have to.
Absolutely.
And so that roadblock, in all honesty, is that roadblock not facilitated or not optimized by the insurance companies in your mind because they want to throttle you a little bit? Or is it just they're not super tech savvy companies or what? Why is it so hard?
It's all of those things. But let's start with what an insurance company is, right? It's an actuarial business, right? Their job is to get the healthiest people they can get to pay a little bit of money so they can take care of people who aren't. The more healthy people you have paying money that don't have to use that money, better off the businesses. That's the basic business model.
Right, because I've always had companies with young employees, and I can tell you I'll have 20 employees at a company, and literally 15 of them will never have used the insurance at all.
Right.
Zero. They don't even know. They don't have the card. Right. They don't know the number. And when I say, you have to elect and you have to pick something, they say, I don't care. I don't use it.
Right. A little bit of friction goes a long way in an actuarial business.
Exactly.
But also think about the process. So there's also the technology side, right? So think about the process of choosing a doctor, right? You get a book in the mail, and you go and you look up somebody in the book whose last name sounds like yours because they're covered by the insurance. It's like,
I'm looking for a Greek.
Yeah.
I want an Opolis.
Right. Yeah, there you go. Right. Yeah. So you want to find somebody who understands your culture, maybe gender, all those things. Half the time you can't tell. We get
actually, I want the person who has the highest ratings from other doctors and has the lowest complaints against them.
Exactly.
Where would I get that information?
Well, there's a ton of data. And so one of the things that we can incorporate is things like how often has that person done that procedure, right? What are the other sources? So you might have seen when I did the demo, or barely a demo, just showed some screens, right? Is things like here's what health grade, Yelp, other things.
Right.
And so you start to roll in all that data and start to make smarter choices. The friction there isn't, there's no value in the insurance company not having you get a doctor. So that's unintentional friction. Right? That's just, we don't know how else to do this. So here's a book that's this thick that I'm literally going to mail you.
Right.
The most advanced ones, you can look something up online.
Right.
And then you say, well.
And like a Web 1.0 interface. It's terrible.
Yeah,
like if you try to pull it up on your phone, you need to be pinching and zooming.
Right.
All right. When we get back from the commercial break, I want to talk about who these PHAs are.
Absolutely.
Personal Health Assistant.
Correct.
Because I'm in love with my PHA, but I just got switched off to another one.
You did?
Which I was a little bit like, oh, a new PHA. I'm a little bit worried. When we get back, the power of the PHA on This Week in Startups. Yes, Envision. Envision app is a beautiful, beautiful product that I use literally multiple times per day to build Inside.com. And some of my portfolios use it to build their apps and their websites. What is it? Basically, it's workflow software and prototyping software for making web apps and mobile apps. Basically, what happens is your designer, your UX people will build the next version of your software, the 2.0. And then they'll send it to you, and you can add it just like it's an app on your desktop. And you can start going through it and clicking and seeing what this new version of your app, your vision, feels like. Then when you want to comment, you can comment on very specific pieces of the app and say, hey, maybe this font could be a little bit bigger, or I'm not crazy about this drop shadow, or maybe this image could be a little bigger, or we can try a different menu style. And then everybody else in your organization, if you invite them to do so, can post comments. And then you can resolve those comments. So you can look at like right now I'm doing Inside 3.0, and I was previously doing Inside's website. You can look at all these conversations and quickly get everybody's feedback and organize it. Now, what did people do before the brilliance of Envision, which you can check out at envisionapp.com/twist, Envision, envisionapp.com/twist with an I, envisionapp.com/twist. They used email. They used PDFs. They used chat rooms. It was a complete disaster. You would get people would, post something into a chat room. What do you think of this? Everybody would write a bunch of comments. Nothing would get resolved. 2 people would miss it. They wouldn't be in the loop. Here, you can make sure every single person is in the loop by saying, hey, can everybody take a look at this and let me know that you've checked it out and if you are okay with this or not. Okay, the sales department's okay. Okay, marketing's okay. Oh, customer service is okay. Okay, great. Okay, the founder is okay. Oh, the co-founder is okay. Oh, the legal department's okay, right? So you can really structure those conversations and product conversations. And if it makes you just 10% more effective, that's 10% more effective than your competitor. And by the way, I think this makes you like 50% more competitive because you're just faster and more efficient and you don't lose things. It has been absolutely life-changing for me as a product designer. And over 300,000 designers are using it right now. So this has, InVision has true success right now. Airbnb, Evernote, MTV, Adobe, Box, Zendesk. Like these are all the best companies with the Airbnb, Evernote, and Zendesk have amazing products. Like they're really designed well. InVision app is their secret. No more email chains, no more missed brilliant ideas. Check it out. You can get a free 90-day account, unlimited screens, collaborators, real-time comments, sketching, and more. Yeah, you can sketch on stuff, which is pretty cool. You can draw arrows and circles and stuff like that, and you can collaborate in real time. So if you say, hey, 1 o'clock, we're doing product review, everybody be there for 20 minutes. You can actually do it as a team in the app. envisionapp.com/twist, envisionapp.com/twist. Thank you at envisionapp on Twitter. Bye. All right, welcome back to This Week in Startups. I'm your host, Jason Calacanis. You can find me on Twitter at Jason. You can find the show at TWI Startups on both Twitter and the Instagram, where Jacob puts out lots of cool clips. And we do the show twice a week. You can subscribe on iTunes or any of those places, SoundCloud. With me today, Geoff Clapp. Geoff Clapp is a super fan of the show. He's been listening to the show forever. You got a favorite episode, by the way? I forgot to ask you that. Or a couple of favorites?
Well, so I'm contractually obligated to say Chamath's episodes.
Now, did you become partners with Chamath and Better? It was after you saw him on the show, right?
Well, so he's had the 2.
Right.
Kind of the first one.
Right. Which is the underground one.
The underground one.
Yeah, nobody even remembers that.
And you can't miss that one because it's actually really good.
Really good, yeah.
And then, of course, the Waterloo one.
Yes.
And the Waterloo one is really funny because knowing him like I do now,
right.
I looked at those very differently.
Right.
Right. You kind of see them very.
But did you meet him? Did you become aware of him through the show? I wonder.
Absolutely. I mean, the first time I was exposed to him was the show, and in fact, when we decided,
and now you're partners with him.
I know, it's crazy.
Oh, wait, so you see what you're saying?
Well, I was just going to say that So one of the first times when we decided to partner on this thing, maybe the second or third meeting, I'm like, the first, I actually felt like I knew you a little bit because I saw you on Twist and stuff, and he laughed and he said some very flattering, but you know what that really means.
Yes.
Things.
He made fun of the fat Greek.
I think he might have said he's like a fungus, but after a while he grows on you, So
yeah.
But obviously
feelings mutual.
Yeah, absolutely. But the Waterloo one was hilarious because you could see there were certain things like when you were picking on him a little bit. There were some certain things. There's one look he gave you, which was the look of like, I'm so gonna get you back. that I only know because I see him give me that look or give Ted that
we have a back and forth.
It's great.
That's absolutely. Okay, so when we left, we're talking about Better, and I hope you've all downloaded Better. It's on Android too now, or no? Just
Android will launch next month, actually.
Next month,
yep.
Okay. So when you are watching the show, it will probably be out, actually. It's going to be out in the next couple weeks. But download if you're on iOS. You get assigned a PHA.
Yes.
And you start talking to the PHA. They start asking you questions. And it's so super simple that I'll tell you my story. I have suffered from motion sickness my whole life.
Right.
It literally is like in the superhero life that is my life, where like everything goes my way. It literally is my kryptonite.
Yeah.
From going to Boy Scout camp with my head out the window puking, roller coasters, boats are off. I cannot go on roller coasters or boats, period.
Right. Planes,
yes. Cars. I can't even sit in the back seat of a car.
Right.
For more than 20 minutes.
That's why I had the Roadster for a while.
Exactly. Right. If I sit in the back seat of a car, I will puke in 20 minutes. So anyway, I'm going to Nantucket, and I said, and I had heard from somebody that there was this, when I was in Italy, David Ulovich had given me this pill, like mezaclean or something. Anyway, and he's like, take this. And I was like, what is that? And I take it for this long drive through Italy for an hour and a half to a vineyard, and I don't get sick. And I'm like, oh my God, it's a miracle drug. So I text her, and I don't know the name.
Yeah.
She starts talking to my doctor in LA.
Yeah.
Anyway, long story short, the doctor doesn't want to give me the pill. He wants to give me a patch. So I pick up the patch, and I leave for Nantucket because I don't have time to get the pills, and I'm disappointed. But I put the patch on, and it works. And I am a champion on a boat
Nice.
with my daughter. I'm like, I could be a seaman now with this patch on. I feel great. So a life-changing moment for me.
Yeah.
And I text her, but I was disappointed about the thing. And then she checks back in with me. She's like, hey, listen, I wanted to check because you've been in Nantucket for a week.
Yeah.
Did you actually try it or whatever? And I wanted to know how it worked. And I was like, it actually worked amazing.
Yeah.
But I want to get the pills anyway, so they got the pills anyway, and I want to get more of the patches, and literally a life-changing experience for me that I wouldn't have had because I would have never taken the time because it's so goddamn frustrating.
Yep.
And I literally was so happy with her that I took pictures of the patch on the boat to send to her because I felt like I knew her and I wanted to share it. And then I had like a little thing where I have a birthmark and it started to bleed, and I always heard this thing like, if your birthmark starts to bleed, hey, this is not cool.
Yep.
And she got me a dermatologist here that I'm going to see in 2 weeks.
Yep.
All of this occurred with literally me typing a sentence or two into a box, as opposed to the whole rigmarole. But who is the PHA, and is that a term that exists in the real world?
Well, it exists in the real world, meaning us.
Well, no, outside of you. Did you come up with that term, or did that exist?
Actually, it's funny. The new Disney movie uses that term in it, so I don't know who we're supposed to sue. But yeah, no, it was something we made up. Actually, we were talking when we started this thing. Chamath and I sat down and started talking about it, and Ted and the team, and we're thinking about what do we want in life. It's really a personal assistant, but it's somebody who's focused on health. Right? And what we found is there's so many stories like yours, other VCs, other people. That's always the story. Just try it. What's your healthcare problem? And everyone's got one, right?
Sure.
And so the PHAs are masters of public health, nurses, people who worked at the CDC on infectious disease outbreak. So there's a team of people. You get one person who's kind of dedicated to you, but around the clock, they're available to you. And if they're that person's, I mean, they're humans. They do go to sleep sometimes. There's always somebody there to help pick up. We're still trying to figure out some of the details of that transaction. As you mentioned, it can be unnerving. Yeah. But those people I'll tell you, it's
a lot less unnerving than having to pick up an 800 number.
Absolutely.
So even if like my PHA got switched, or there's, because I had Meg originally, she was dynamite.
Meg's great.
But if I have to talk to somebody else, that's fine. I just trust the brand. I kind of feel like you're the Apple of healthcare for me.
Well, that's very nice.
That,
Thank you.
like, you just made something simple and elegant. It's actually, I would even say, actually, the Uber of healthcare is what it feels like, because you found the number one problem, which is, I don't know how to phrase it, but maybe running traffic. Yeah. You know, being the air controller, being the assistant, but it's not just being an assistant that sort of diminishes it, because I've had assistants before and tried to do this. They don't know the healthcare system. That's the thing. What you have is people who know the healthcare system and know how to operate and get shit done in it. Yep. So how did you come to that idea? Because when a great idea happens, you must have had 7 ideas. Yeah. And I remember I was one of the first users in the system, amongst the first. Absolutely. It was very focused on like picking how you're feeling through like a menu of content, and it was very content first, and then it became chat room first. Yes. So tell me how you got to that, how you did the product iteration. Yeah, it's a great question. Because I noticed. Yeah, absolutely. Well, I think so. We've been live since April, so a little over 6 months, right? And we first launched, honestly, we were still trying to figure out, do people see the same thing we feel? Are we too insider? Are we still... And we were kind of haves and halves, if you will, on content and chat room, as you mentioned. And what we realized was everybody had a story. Everybody wanted to talk to somebody. Everybody wanted help, right? So honestly, the first A stood for advocate, personal health advocate. Yeah. But then people are like, well, can I ask my advocate to do things for me? Or is my advocate just out working on my behalf? Right. So when we changed it to assistant and we said, just ask, whatever you need, just ask us, because we can do anything. Right. And we said, like, let's get all the other stuff out of the way. Let's remove the clutter, which is the Apple move, if you will. Right. Remove all the clutter, get to the core. Right. And honestly, I keep every week, every sprint planning meeting is like, what can we rip out this week? Not what can we add, right? Just bury it and then make that feed experience better. Absolutely. Now, let's do some blocking and tackling stuff. Yeah. How does it work in terms of prescriptions? Because that's where I think anybody who's going to object to this system, I don't know who would object to it, but anyway, you know, there's always those people who are like, what about abuse? Yeah. So you have this sort of like people who are coming up with the hypothetical abuse question, and then there are the people like me who are like, well, actually, like getting a prescription for this nausea medication was absolutely critical for me. Yep. What are you allowed to do and not allowed to do when it comes to prescriptions? Because that happens super quickly. And then I needed to get Robitussin I wanted to get a Z-Pack. And I asked for a Z-Pack because I know I want a Z-Pack because I take that. And then my doctor called me 10 minutes after I asked my PHA to take care of it. And Dr. Karashawi called me from LA and said, listen, what are your symptoms? Maybe walk through the symptoms again and said, you don't need the Z-Pak. You're going to write it out, but I'll get you a nasal thing.
Yep.
So what about prescriptions?
Yeah. Prescriptions are really interesting. There's so much that there's a line. There's about 13, 14 drugs that you can do in most states. But it comes down to just like licensure, it's a states' rights issue. Mm-hmm. And so you have to be experts. I mean, I've been doing this now I had a previous startup that was very successful in the space as well.
What was that startup?
Health Hero Network.
Uh-huh.
And we sold that for a couple $100 million. And
who'd you sell it to?
Bosch.
Oh, wow.
In Germany. So
cool.
That was a great run. Whole different story.
Yeah.
But you learn a lot about how the healthcare system works. It's extremely fragmented, right? But let's take that situation with your doctor that you just talked about. I don't like the word disruption because it's so overused, right? But we're asking the healthcare system to do something. We're a foreign antibody right now, and the immune system of any creativity goes after, big organizations goes after that kind of stuff. So even your doctor, who I'm sure is great, was like, "What's a PHA? Who is this person? Why does Jason want a Z-Pak?" So what we're doing is we're just constantly working closer and closer and closer with doctors to understand this is why, these are the issues, here's the one-page report. And as we keep infiltrating, if you will, the system, that we'll have those things on your doorstep next year.
Wow.
In 2015, you'll get those things. Now, you live in California, so it's a lot easier in some cases.
Right.
But we'll have those things delivered to your doorstep. You'll say, this is what I want. We're going to talk to your doctor. Mm-hmm. We're going to make sure this is okay. This is coming. It'll be here tomorrow.
So when you talk to my doctor for the first time, what is that script like? Because now he's talked to my PHA at least 3 times.
Yeah.
So what do you say? Hello, Dr. Karashawi. I am from an app company called...
So we're a healthcare service company, right? And so part of the big things with healthcare is taking out, like, don't talk about Palo Alto. Don't talk about apps. Don't talk about LTV. Don't talk about all the things we talk about every day and you talk about on the show.
So what do you say? What is the line you say?
We get right to, I am Jason's personal health assistant. Mm-hmm. My job is to help keep him healthy just like yours, right? Uh-huh. I've been talking to him about the following things. And this is a plan that we've worked on together. I want to work with you to make sure you're okay with the plan. You got to play the doctor's egos.
Yes, of course.
Right? And their expertise. Honestly, we're not doctors.
And then they say, like, how do I confirm that you are working with Jason or whatever?
Yeah, so there's usually a question of that. And we go through, okay, we've got his insurance information. But here's the best case. I love this use case. People will give us that. Insurance companies give us that all the time. We don't know who you are. Kind of give us the attitude.
Yeah.
We'll say, hold on one second. Right? We'll conference you in, or we'll conference in the person, and they'll say, this is who I am, verify my information. You have my authorization. We actually have HIPAA authorization forms.
Love it.
We get it all structured, and then it's like a power of attorney. It's our job to help you be healthy. And once we go through that step, but the insurance thing is so great because the insurance company, we say to people, look, we're going to wait on hold for 2 hours for you.
Yes.
You're going to hear from us. When you hear us, pick up. Just say yes, no, hang up. We'll take care of all of it. And you only have to do it once.
I have a very important question that you're going to answer after we get back from this break, which is, how is this effing possible for $50 a month for my family? My family's insurance must cost $1,200 a month.
Sure.
You cost half of 1 month, so 1/25 of the cost of my insurance. Yet, I would say 90% of the value from my insurance comes from better. So how is it possible at only $600 a year for you to do what's costing I get charged by my health company $13,000 a year when we get back on This Week in Startups? Oh my God, I love Audible so much. I'm addicted to the Audible app. My wife is addicted to the Audible app. I'm constantly listening to books. And you know what happens to me as a business executive? I'm busy. I don't have a lot of free time, but you know what? I drive. So sometimes I'll be driving down to play poker at my friend's house or going to a meeting or going to a conference, or I'm taking my daughter to something, and I have an hour. I have half an hour. I've got 20 minutes. I'm going for a hike. I'm on the treadmill 3 days a week for an hour, right? These are like moments in time when I could be learning. And so I use Audible. I'm on the Platinum subscription plan, but you can get a free book right now, audible.com/twist, audible.com/twist. And I'm going to tell you the book to get today, which is 0 to 1, which is the new Peter Thiel book, and it's really, really good. And I'm not saying that because I know Peter or anything like that. It's just he's got a really quixotic, like weird view of the world, and he is a real contrarian in some ways. He just thinks a little bit differently and frankly oddly about the world. And the book's a little bit challenging in that way. You're not going to agree with everything, but you're going to learn a lot. And it's just a great book. So 0 to 1, which is by Blake Masters and Peter Thiel, and it's narrated by Blake Masters. 0 to 1 is my Audible choice of the week. But I wanted to mention a couple of other things. They redid the app now, the Audible app. And one of the great things is it now has badges, which is super fun. It tells you like I have a badge called Closer here. I'm looking at them. Nibbler, High Noon, Weekender. It just gives you like little motivational things that like, hey, you're doing a good job listening to audiobooks, which I consider like going to graduate school or just making you more worldly. And it is a fantastic product. And over time, you just wind up having so much knowledge that, you can reference a lot of it, and a lot of it is tactical, but a lot of it is also strategic and then even inspiring. And so I really find like the business category and then psychology and even some fiction really help you catch up. And if you don't even like read the basics, like Lean In by Sheryl Sandberg, which I have here, which is great, David and Goliath by Malcolm Gladwell, the Checklist Manifesto, a lot of these things, I think, the 5 dysfunctions of a team I've talked about before. I love that. We got to get that author on the program. Flourish. I mean, there's so many great business classics, good to great. If you haven't, Built to Last, if you haven't read these, you are not properly educated to be a CEO or founder. There's 150,000 titles. Get started now. And if you don't like a book, you can exchange it for another. No questions are asked. And again, 0 to 1 is my Audible pick of the week. And go to audible.com/twist and get 0 to 1 for free. 30-day free trial. You can download the book of the week for free. And everybody follow Audible_COM on Twitter and tell them thank you for supporting independent media like This Week in Startups. It's such a great product. And I've been talking about it literally for 5 or 6 years. On This Week in Startups, on Leo's podcast, This Week in Tech. We're all super fans of this product. It's fantastic, and you're going to get so much out of it. Audible.com/twist. It really is, for me, a pleasure and super honor to read their ad because it's literally one of my top 5 apps. Literally one of my top 5 apps on my phone in terms of usage. Hands down. It's like email, Twitter, browser, maybe some casual game, and Audible. It's like, that's the top 5. That's what I do on my phone. All right, let's get back to this program. Hey, everybody, it's Jason Calacanis. Welcome back to the show. The show is This Week in Startups at TWI Startups. And if you are a super fan of the show or a new fan of the show, it is your geary, it is your duty to support the show by thanking the sponsors on Twitter and just by saying, hey, Jason, what's up? Hey, at Jason, I listened to this episode. This way the team here knows that people are listening. We love to interact with you guys on Twitter. So make sure you follow at TWI Startups. And thanks again to our sponsors for making this possible. Hey, and thanks to our friends at WeWork Golden Gate here in San Francisco because they built me this great studio here. It's gorgeous, and I'm able to do my show. And now that I've moved up here, it's so wonderful, and it's a great place to work. But I think they're sold out. But they have all of the other cities, New York, Boston, D.C., Seattle. Go to WeWork.com. Really, just a really great, classy operation here. The coffee's great. The guy who cleans up the coffee's great. The front desk is ridiculously nice. Just everything is awesome. So here we go. When I left our hero, Geoff Clapp, who is GeoffClapp on Twitter, go ahead and follow him. And he's the co-founder of Better. You don't call yourself CEO? What do you call yourself?
Co-founder.
You're just like co-founder? You're just like not like ego-driven with the CEO thing?
Definitely not ego-driven. I think the other thing is that because I've done this once before and been successful, nobody's going to remember what my title was. They're going to remember if we hit a home run or not. That's all that matters.
Love it. So. I love it. So pricing.
Yes.
It started at $50 a month, I think was the price.
Yeah.
And then you said $50 a month for families, $20 for individuals, or $30 for individuals?
Yeah, it's $49.99 for families still, and $19.99 a month for individuals.
So $240 a year and $600 a year, basically.
You can actually, if you sign up for the whole year, you get another 10-20% off.
So I've saved at least 5 hours of my life. My hours are worth a lot of money, like $300 an hour probably. If I was billing out, it's probably worth like $1,000 an hour if I was billing somebody for them. But putting that aside, I am going to easily get 10 times my money's worth.
Yeah.
How did you decide on the pricing for this? Are you just underpricing it?
It's a really fair question. I mean,
it feels really weird to me. I feel like it's too cheap.
Yeah. Do
you hear that from people?
Yeah, I do. I think here's the thing. we want to help people. Our mission is to help people, right? And our mission is also to grow and to learn. And we don't want to be free, right? We want to make sure there's value in this. There's definitely value in this. But I think we first have to show people that this thing exists. You talked earlier. What is a PHA?
Yeah.
I don't know what that word means, And so is it underpriced? Probably, right? But it's going to be, we're at this early stage where we're like, who can we help? And I'll tell you the stories we get of people, new cancer diagnosis. I mean, your examples were great. There's a lot more.
Yeah, tell me the best example you got. What's the one that, like, in the office, you guys were all like, you know what?
Yeah.
I love coming to work, and like it kind of feels important,
We've had a couple of those. One of them, a lot of times it's people caring for parents. We're all kind of going through that phase. I lost my dad when I was really young, but my parents are getting older. I talked about my grandmother earlier.
Yeah.
People with kids who are sick and people with parents who are sick. Because look, people that are working at Facebook today, like you said, 20-somethings or whatever, their issue isn't themselves. They might sprain a knee playing ultimate frisbee. They're not getting hurt every day, right?
Yeah, they're generally
healthy.
Right? Generally healthy. Generally not getting cancer, although it does tragically happen sometimes.
It tragically happens, and you want to be there for them too. But it's like your parents get sick, you live far away. My parents are in Boston.
Yeah.
You want to, and the thing is like you can't. Money doesn't fix health,
no.
Right? You can't.
No.
The rich don't get any less sick, right? And I think the other thing is that I didn't want to build something that was just for a certain class of people. I want it to be like if you're sick or you're healthy and you don't want to be sick. That's the other, right? You don't have to be sick to use better. Hopefully you want to avoid being sick, but you just don't know how to do it.
Yeah.
That's what we owe society. Not a segment of society, but society.
Right.
So we wanted to make it approachable. Whether it's the right number or not,
all right. So you mentioned before that you will deliver the stuff directly to my doorstep next year, which would be outstanding when you're sick. And by the way, I just ordered for the entire launch team.
Yeah.
Which I think we have about 10 employees. I was like, you know what? This has been so transformative for me. And I'm already spending whatever, $300, $400, $500 a month for everybody's. I don't know what it winds up. Maybe it's $300, $400. On people's insurance, they're not using it. I might as well just give them a company subscription to this. So we're going to be implementing that, I think, next week or the week after. But
it's exciting, yeah.
And actually, as far as the benefit goes, for $20 a month or whatever it is, or maybe a little discount for group pricing, this is a huge benefit for corporations to give to their employees, because the employees are not experiencing the value of their healthcare generally, like we said earlier. And this is so delightful. It's like letting people know that, like, by the way, you didn't know, but on the roof there's a pool.
Exactly.
With free pina coladas all day.
Exactly.
It's like, really?
Yeah.
And you're giving them the card key to get in.
Right.
That's like you're unlocking this crazy value. So I was going somewhere with that, but what will come next year? Oh, the delivery of the medicine.
Yeah.
So you're going to charge me for that, obviously, the delivery, right? It's got to be a delivery charge.
There'll be some charges as we ramp up the whole prescription pieces.
Got it.
But we want to make that, and it might be, honestly, and you talked about the pina coladas on the roof.
Yeah.
A lot of times your insurance actually will cover the mail order delivery and the delivery of stuff. You just don't know it.
Wow.
There are so many people we say, do you know you can get acupuncture? Do you know you can get this? Do you know you can do that? Because here's the thing. We work for you. That's why you
So that's what I love. You are my advocate.
Exactly.
As opposed to the other person's, and you're not compromised.
Right.
See, in the real estate market,
right,
both parties are working with each other to close a transaction so they get commission.
Right.
In your case, you have the insurance companies which are trying to have as little utilization as possible, and then you have you trying to make me renew my better subscription and tell my friends that you're trying to get me to have a net promoter score of 9 or 10.
Absolutely.
That's all you want.
Absolutely.
So how do you telegraph to me what I can get? Is that like another proactive thing? Because I haven't had that happen yet.
Yeah, so it's actually a new thing. Crystal, one of the people we talked about, right?
Yeah.
She's an insurance savant, right? Mm-hmm. And so we've hired a couple people recently, and that's actually one of the proactive things. Actually, there's a couple proactive things you're going to be getting.
Yeah.
One of them is kind of your one pager when you start making appointments and say, I want to go to see this GP or even a dentist or whatever. Here's everything you need to know. Here's what the doctor needs to know. No more don't take out your phone and try to scroll in front of your doctor.
Yeah.
They don't want to see that.
Yeah.
Right? There's a bunch of proactive things like that. One of them is that insurance review. So actually, because of when you slot it in, it's a new onboarding thing. So everybody who onboards in the last couple of months have got that. We have to go back to the early adopters like you, and roll out that insurance piece. But one of the things you said earlier about like who you work for, right? This is where the doctor thing is really interesting. Doctors don't go into medicine to do billing. Doctors want you to be healthy, right?
Yes.
So the reason that we are able to work so well with doctors is the doctor just picks up the phone, talks to us, confirms, does all the security stuff and HIPAA things they need to do. But the doctor's like, I don't have to write any codes in. I don't have to you're just here to make Jason healthier? Because guess what? If Jason's healthier, that makes my job easier.
Of course.
You're kind of on the right side of history, if you will.
Yeah,
right?
yeah.
Our job isn't to sell you insurance. In fact, our job isn't to sell you anything.
Right.
Our job is to make you happy. If you're happy, you stay. And that's why when you brought up employers, next year we'll do more and more employer things, but consumer, direct to consumer, because every time somebody ends a subscription, I feel that.
Yeah.
And you got to feel that pain as an entrepreneur. You got to be like, wow, that person decided we weren't worth $20. And it happens sometimes. And everyone in the company has to feel that pain.
Right. So do you let everybody know? How do you do that?
Internal messaging, hip chat. So.
Oh, really? So when somebody unsubscribes, goes into the all chat room?
Oh, yeah.
This person unsubscribed? Does it ask them a reason why?
There's a reason. I talk to every single person unsubscribes.
Wow.
And there aren't that many, knock on wood. And so I talk to every single one of them. And
do you try to save them, or do you say like?
Oh, for sure. I mean,
okay, so you're trying to save them.
Look, I'm an entrepreneur. At the end of the day, I'm not like, hey, sorry. It's like, what could we have done better? If it's, you want to give us a couple more weeks, is there a problem or whatever, right? Of course you're trying to save them, but more importantly, it's like, no, that person's like, was not happy.
Right.
That whatever reason we didn't make that person happy, we all need to feel
What are the things you've learned in that process? You're a big transparent guy. What have you screwed up? We
grew too fast at one point. And I know that sounds like the backslapping thing. We didn't do it responsibly, and our response times dropped really low. Like it would take a long time to get back to people.
Right.
Like certain coverages of hours. Like it didn't. All that stuff that you were saying earlier about feeling it work for you, there was a phase where we were adding 3,000-4,000 people a day, and we weren't getting back to people. And it was like, this person doesn't feel like
the growth team, because I know that Chamath has a sick growth. That's a little secret over there, is that Chamath has like these secret Facebook guys who did the growth on Facebook, who work for Chamath, who then go to the portfolio companies and do magic. So tell me about that group and unpack it a little bit now that I've pulled the veil back. Sorry,
the
Chamath.
Secret, well, let's pull it back further and thank those guys very specifically. So Andy and Ray.
These guys are killers.
Oh, God. I mean, Andy.
Hipster Andy is amazing.
Hipster Andy, yeah. He's so actually it's funny. So once a week we get together, we go through stuff. We
get hipster coffee with.
We go walk to Phil's and
hipster coffee.
And he and Ray too, and both of them. Andy came out of OMG Pop, and the gaming side, and Ray out of Facebook. And there's a bunch of other people there. Those are the two that work.
Those are two leading the group.
And what's great about it is that they offset healthcare experience, or because Andy's like, let me compare this to building a castle, because he's coming from the game world, right? He's saying, we've got to make this like dropping a castle on this block, right? And it's a whole different way of thinking. And I think that's why I wanted to do this partnership with Chamath, because it brings a totally different way of thinking. And it's not this, S&C brings obviously a lot of intelligence across the board, but a very different way of thinking that healthcare hasn't seen before.
Right.
That's different than my experience. So it's more like peanut butter and chocolate.
Yeah, well, you know how to make a great product. They know how to scale products over there. So that is their speciality. So what, just again, going to like sort of the blocking and tackling stuff, what on a growth basis works for a product which I will say nobody has experienced before? Yeah. It's not like you're telling them to, get more mana in Clash of Clans or play more minutes in, Candy Crush or something. There's no metaphor here to buying gems. Right. It's a whole new thing. Yep. So how do you convince people, and how do you market that, and what are the best channels? Yeah. So the number one thing that we found, I'm gonna put a secret out there, so anybody listening to bookmark this moment.
Absolutely, is
founder giving secrets
on the medical on the iTunes store. It is a browser market. If you can stay in the top 5, people spend a ton of time looking for free medical apps, right? Ovulation, pregnancy, us. So we've
Fury Tracker.
Yeah, absolutely.
All this stuff. Yeah.
And it's one of those things, and you see it on the weekends. Yep. And it maps exactly. I mean, you've got to be good. I think it's another thing that Chamath seems really good at is getting you kind of not only off the ground, but expert level immediately with like App Store analytics and the whole process of like, here's the data, here's the systems, here's the stuff we got to put in place. So we're just flying. So
you're on second base already.
Oh, absolutely.
But then when people open up an app and it's like, talk to your PHA, it's like, what's a PHA, and what am I supposed to do here? Yeah. So do they just confuse it and think it's insurance, or it's just advice, like a Q&A service like Expert Exchange or Quora?
Well, I think one of the things we've learned, it's been really interesting is, and the Quora example and the Expert Exchange is a really good kind of, we have hit a lot of that, right? Yeah. It's like, is this a forum? Is this a group? Who's behind it? Mayo Clinic is one of our investors, and they actually help provide some of the services. Right. So we have to get that clinical expertise out really in front really early.
Yeah.
We have done so many experiments on the onboarding process. What those first, we talk about time to PHA and then time to first message, right? So I think that's a big part of like learning how does this stuff fit into what you're trying to deliver? And then most kind of excitingly, if you will, how fast can you get somebody to respond? Because once they're responding and they're in the chat, you can get them. It's like, okay, here's what we're going to do. Like, we're going to do this for you, this for you, this too. And everybody's like, wait, you're going to do all that stuff for me? I haven't even put my credit card in. Yeah, no problem.
But can you automate that? So when I first open the app, it should just say it should be like a little thing that's like, so I'm your PHA. Here's what I do. Do you have health insurance? Yes or no? And you say yes or no, and it says, okay, who's your brand of health insurance? That should be like a little bit of a script.
Yeah, the first set of screens in the Nux, and actually we're in these like 2-3 day cohorts right now. We're changing it every 2-3 days. Wow. And just cranking on data.
That's hard to do, but you have such a simple app. It's not like you're changing the core app, so you're optimizing the app.
Optimizing constantly. We spent a ton of time building it in so we can change it on the fly, no App Store submissions.
Really? How do you do that? Because I want to do that for Inside, and I was talking to the Uber guys. They do that. They change the menu bar on the fly. Put kittens in, then take kittens out.
Right.
Like deliver kittens today. But how do you do that?
So the biggest thing is like figuring out architecturally, especially speed-wise, we need to be a little faster than we are now. Yeah. What needs to be native and what can be sent server-side, right? So we have a whole system that has got the architecture out. So the whole Nux, the order of the screens, almost everything can be controlled server-side. Wow. So tomorrow we could be like, oh, and now we're going to switch it this way. We're going to drop this thing out, put this thing in by your cohort that you're in.
Neat.
And so it's pretty awesome.
How much time, let me ask this in terms of iOS development. It's a really good discussion that's very relevant for people. How much time do you spend today with working on, let's say, the main features of the app versus testing and optimizing the app, right? Yeah. In terms of developer cycle. So if you had 5 developers, how do you assign them?
So we are probably, right now, I would say we're 80% test.
Wow.
And I think the reason is because enough people have told us, look, I'll put my credit card down. I like this thing. I want this thing. They've downloaded it. As we've said in a lot of the UA meetings, look, top of funnel, we can get people in through targeted Facebook ads, through other types of paid acquisition and organics in the list, right? But everything's not perfect. We're losing people here. We're dropping somebody off here. They didn't respond fast enough here. And all of it's test and tweak, age, gender. Gender's a huge part of healthcare.
Interesting.
Yeah.
So if you have a female in, this age group, you can have a dialogue with them about certain issues versus a man in those groups.
How do I get you to tell me your age? Well, that's on the sign-up screen today, but maybe we could pull that out and do it later. Gender and insurance information. From there, we can do an amazing amount of service.
Interesting.
But if we don't know those 3 things, there's a lot of things we can do, but it can't be this complete like don't worry about it, Jason.
Yeah. So question from one of our listeners, Kurt. He says, are there any FDA or AMA that restricts patients from accessing PSAs who are offshore?
Yeah.
Or does FDA and AMA care? So first of all, are your PSAs offshore or here?
No, our PHAs are all here. They're actually all in the state of California today.
Okay.
We will spread them across the United States. For us, there are some things we've looked at. We looked at it. We said, what does this mean? But honestly, it's one of those things where it's the same thing I said about you look in the back of the book and you look for someone with you want to know it's somebody who they're going through the American healthcare system too. They've gone through it. They understand it.
Yeah.
And so every picture that you see in the app, that's a real person. There's no clip art, no fakes.
Yep.
That's their real first name.
Yep. It's not 3 people under one persona.
No.
Got it.
No, there's no faking. In fact, long product discussion about, well, if somebody comes in at 2 a.m., do you want to pretend it's their PHA or just, and it was just like, no, they're humans. It's real. And
so
it's
another
trust.
PHA can jump into my feed?
Absolutely.
Yeah. So what about allowing my doctor to join my discussion in the app? Because I was thinking, wow, I would love to have my doctor in here, but then I was thinking, I don't think my doctor wants to be in here.
Right.
And then I was thinking, well, can I have my doctors as the equivalent of Slack chat rooms?
Exactly.
Or, HIP chat rooms or Yammer rooms, and just be like, okay, my dentist, my doctor, and my nutritionist are all here.
Right.
Or could you upsell me on a nutritionist? Because that's another thing I want to work on is nutrition.
Yep.
So I'd love to, and I don't know if I should talk to my PHA about nutrition, but I'd love to have a nutritionist giving me a little bit of advice, like, hey, here's some things you might want to eat more of or less of or whatever.
So not just to stay on you. you should tell her that today.
Yeah.
Because there's actually a nutrition on staff who will actually work with you on all that stuff.
Yeah.
And then that's exactly where the PHA will say, hey, I might not be a nutritionist, but I've got one here on staff. I'm going to pull her in, and she's going to work with you.
Yeah.
And when you have questions and you're going to say, hey, Ann, or hey, Meg, or
Yeah.
hey, whoever, I was wondering about this, or I want to start eating this way, or I'm concerned about my sodium, she'll jump in and handle those tasks. And the task management system on the back end is what gives it all the scale to allow all of those things to get distributed to the right people who can solve the problem.
Got it.
Yeah.
And so what's the scale of company today? How many employees do you have?
We have 27.
27.
Yeah.
So it's not small.
It's not tiny, no.
No. And I would assume you have hundreds or thousands of people using it? Something in that range?
We got probably, we had 60,000 this month, 60,000 this month. So, yeah. So
yeah. But how many people would you say are using it like I use it, which is to say monthly?
Oh, yeah. Probably about...
Like paying customers using it monthly, thousands?
Thousands.
Yeah.
Yeah. Oh, yeah. Probably close to 10.
Wow.
So of people using it getting stuff done every day. There's a certain amount, some of those fixed on different plans, different tests.
Right.
But thousands of people.
Now, is there an opportunity to do this for free for consumers, but have some other type of monetization, like advertising or, the drug companies pay for it, and have you looked at that? Because you did say you wanted to reach everybody, but you know what, like the single parent who's barely getting by, this might be like the last thing they can afford for their family.
So I guess there's two ways to look at that. I really don't want to do – so if there's health insurance is the most hated thing in healthcare, drug companies probably aren't far behind.
Right.
And I never want to lose that we work for you. There's no awkward incentives. If you come to us and say, I want to go on generics, we don't go, well, our sponsor, if you will.
Yeah.
I don't ever want to pervert that. Right. I think that's what's wrong with healthcare is there's so many perverse incentives. So by not losing that, whether it's advertising or other things, but there are a lot of places, both in insurance, in grants. We actually spent a ton of time with the Pramana Collective folks when we launched their PR firm, Twitter. And when we first launched, we were sitting down and kind of doing some strategy work with them, kind of the PR heads, the former Facebook and Twitter and a bunch of other folks, really powerful, really smart folks. And we really wanted to do that at launch. We really wanted to have a way to say, look, if you're under this poverty line or you're under this thing, we're going to take care of this for you. We're going to figure out a way to get you grant money. I still think we can figure that out. So my goal is to do that in a way that doesn't pervert the incentives, but aligns the incentives.
That'd be very interesting if the Gates Foundation was like, hey, we know there's this many people living below the poverty line. Right. If you have, how would you determine that? If they're on food stamps or whatever, is there a way to say, hey, this person's on this type of assistance. If they have this card, they can use this for free?
There are a couple different ones. A lot of them are actually going to be working with state and local government, big people that are taking advantage of state and local government health benefits. So you go and King County, Seattle did this with a pregnancy program, a text for pregnancy program. Those are the places we're going to have to go and say, look, your city, you're a little, we want to help the underserved here. We're not going to make any money off of this, but we know we can help these people. Right? Let's work together. Here's the grant structures. But that's going to be just like the doctors, and we'll come back to that in a second. There's going to be a lot of door-to-door, city-to-city, but I just think that's got to be part of our ethics and our fabric of the company, which is, you can't afford an iPhone, you can't afford an Android. We've got to be on the web. We've got to be everywhere people can get. If you go to the library and use us, because that's the way it works, fine.
So question for you.
Yeah.
Another big pain point I see is just the publishing of prices.
Yeah.
Like, you go to a restaurant, they tell you how much it is to get a side order of bacon.
Right.
You go to a doctor.
By the way, your nutritionist is going to tell you to stop getting the side order of bacon.
All right, whatever. I'm going to get the side order of, whatever. Spinach, kale, my kale side order. Yeah, but they don't ever show you the menu of prices.
Right.
And I noticed in the app, I never saw how much I was paying for stuff, whatever. And I was like, wow, this is an easy layup that would make me feel really cool if, as part of Better being on my side, they just were like, here's what you got charged, here's why, here's your thing.
Yep.
And, hey, you want to see a doctor? Excuse me. There is a walk-in clinic. It's out of network. Here are their prices.
Yep.
And maybe start pushing the rate card. How come there's no rate card? Is there a rate card responsibility in the new Obamacare stuff or the regulations?
Not as much as we would like. Medicare mostly.
Yeah.
So basically, there's in those use cases, really what you need to do is you need to say, look, for our user, what's the best thing for them? So for example, if you call our nurse line, you're talking to a Mayo Clinic nurse, doctor, specialist, and that person says, look, this is what I think you need to do. The PHA is on the phone with you, and the PHA is saying, I found the closest urgent care. I found in your insurance and done some of those things. This will cost less. Hey, this one's closed, but this one costs $20. We can get you there. Let's go get you there. That's just got to be part of the base piece. Right. But I think you're right. Like also, the problem is, as a society, we've been taught things that are more expensive are more valuable. Right. That's not true in healthcare pricing. Right. Healthcare pricing is more based on your location, the overhead of the hospital, all these other things.
So opaque, too.
It's just ridiculous. But a lot of that data, thanks to Todd Park and who is the former CTO of the United States, he's helped release a lot of that data. And we can now be integrating all that data. And there's some companies that do that, just that though. And we want to combine that pricing with like, how do I value this? Because if I tell you, Jason, you can get a knee replacement. This one costs $1,000. This one costs $5,000. Which one are you going to get?
Yeah, of course. Let's go. It's my knee.
Right. You're like, I want to walk forever. I want to play with my daughter. Like, this is my decision making isn't going to be. But if we can help you walk through, this is what the prices are. Hey, by the way, that doctor with $1,000, he's done this procedure 1,000 times, and everyone said he did a great job. Right. And
the 5,000 one does it 3 times a year, and they charge that much because they don't want to do them.
Exactly.
There could be all kinds of just perverse, weird stuff going on. There's no transparency.
Well, that's Let
me ask you about Obamacare. Sure. I don't really know enough about it, but I do understand that there is a massive amount of opportunity, putting aside politics, because I don't care but about politics side of it, but there's a massive opportunity for entrepreneurs inside of those documents.
Without question.
And we're in year 1 of this?
Yeah, we're going into the second open enrollment tomorrow.
Oh, really?
Today.
Wow. So we're basically in year 1, going into year 2.
Yes.
What are the opportunities as you see them in all this Obamacare stuff?
Well, so I think
it shouldn't be called Obamacare. What's the actual name of it? American?
The Accountable Care Act.
Accountable Care.
Yeah, and there's a few other sub-acts. That's the one that tends to be used synonymously. Yeah. Right? So I think the
Affordable Care Act. Yeah.
Affordable Care Act. I think the single most important thing. So Travis from Uber said the other day, and I thought it was great. He said, I love the ACA. And he said, I love the ACA because all of my workers now have choice. I can start to open up to a larger workforce, right? So just in terms of spawning innovation, right? And all of a sudden saying, look, if I'm this small, I don't have to carry all this healthcare benefits now. I don't have to be paying some HR coordinator all this extra money, all this insurance stuff. Here's a bunch of choice. Here's a bunch of options. We'll work out a deal. Here's some cash. Let's get your insurance done off my plate. Right. And so when you start thinking about sharing economy and larger things, that's one thing that's huge, whether you're in healthcare, whether you care about healthcare or not. Yeah, because the whole concept
of employment is changing, right?
Absolutely.
Like the idea that you have a full-time job and you're married to it and you're going to be there for 5 years. Yep. I mean, that's what a lot of this ACA was supposed to handle, is that people flip jobs more frequently. And then what if you take a job that's 3 or 4 days a week? It's enough to sustain you, but it's not enough for the employer to have the burden of your health care.
Right. Well, I think decoupling, starting the process, and this is going to be something we're going to look back on in 10 or 15 years and say, boy, look at how these two paths converge, these two rivers came together, right? Yeah. One of them is that sharing economy, change in what employment means, and the law allowing this thing to come together. I think the other thing that's super important is, what do we want to be as a country? Let's just start there, right? Should the uninsured have the ability to get health care and have a way to not be uninsured? Yes, that makes sense, right? Should pre-existing conditions go against you as you move forward? Yeah, that just makes sense. That's how the world should be.
Pre-existing conditions should not go against you.
Should not go against you.
Right,
yes. If I said it backwards, I apologize.
Yeah, no, I just want to make sure.
Yeah, it should not go against you. And these are the things, they should not count against your your future ability to get health care. Despite what you think where the line of socialism is, these basic tenets are there. Yeah. But as entrepreneurs, there was also a bunch of things that said, look, you get discharged from the hospital, that hospital should have done a good job. And we're going to judge whether they did a good job about whether they get penalized or get money for you coming back, right? And although it wasn't actually technically under the ACA, all of the things around electronic medical records were part of the legislation that led up to it. People often say it's part of ACA, but it's actually part of another act. But it's all the same timing, right? So you've got electronic medical records, all of this data.
So they're forcing people to have electronic medical records now. You have to do it right.
Yeah, there was a carrot and a stick phase, right? The carrot phase of here's a bunch of money, we'll help you pay for it. And then the stick phase of now it's penalties. So you've got digitized data. You've got people with money in their pockets that get to make choices, right? You've got an ethical alignment with, I think, the people that we want to be as a country. Yeah. And then you've got this huge technology swoon we continue to be in, right? So if I walk into any VC's office and say, okay, I've got people with money that don't know how to spend it, right? They don't really know what to do. It's a new thing, right? Healthcare is really complex and really hard to understand, right? We're digitizing all of the information, all of the records, right? That's like the world's best playground. It's like financial data 10, 15, when Mint was happening.
Yeah.
That's where we are now in healthcare.
Wow. So there's a ton of opportunity there.
Tons of opportunity.
And what do you need, or what do you wish you knew before you started in the healthcare space that you now know that other people need to know in terms of operating in it?
Yeah, I used to say, because it was after I left Apple, I used to say I was too young and too dumb to know how hard this was going to be, right? Yeah. But I don't think it's any harder than anything else. Now I don't believe that. Right. You've got awesome organizations.
But it used to be that way.
It used to be that way for sure. I mean, it was, we were Business Week's best product in 2000. Right. And at that point, people were like, healthcare, who cares, right? It was just a very challenging regulatory landscape and everything. Now, all I would want people to know is don't believe all of the stupid stereotypes. Because when a new market comes about, you got all of the old timers and the gray hairs saying, oh, it's overregulated, oh, it's too hard to do, oh, no one will pay for that. Like when we started to go to direct to consumer, people I really respect but have been in healthcare for a long time said, consumers, they won't pay for anything. They don't do anything. I said, look, that's the definition of a new market.
Right.
How do we go get all of those people who, by the way, never got in a black car before Uber either?
Yeah, no. Nobody drives electric vehicles. Right. Why would they start?
Exactly right. And so you've got to ignore all the noise, right? Regulation, forget it. Push through it. Yeah. Right? If you can't push through it, you shouldn't be an entrepreneur in anything. Right.
But it's not insurmountable now, the regulations. And actually, the regulations are pro-digitization and efficiency.
Absolutely.
What will the healthcare space look like in another 10 years? If, let's say, companies like yours succeed and the momentum in the country continues on the path it is, which it seems to be that everybody has healthcare. What will it look like in 10 years?
So, I mean, for me, it's kind of that aspirational piece too, which is that independent of my zip code and independent of where I live, I can get the best care. So what you're likely to see potentially is fewer doctors, more centers of excellence, and telepresence and telecare, right? Yeah. So if I leave Palo Alto, let's say this startup hits it as big as the next one, and I don't have another twist to motivate me to do my third, right? And I move to Idaho. Why should my healthcare suck? Right? Yeah. Why should my healthcare suck? Because I want to move somewhere, right? And so I think telehealth and telepresence where I should be able to get the best care no matter where I am, right? That includes things like in-home testing, right? I got to be able to drop my blood on my iPhone and then to say, this is what it looks like. This is what's going on. I should be able to do a lot of those things myself. It was only last year, that you could even get your own blood tests done through the CLIA Act and get access to the data in some states.
Really?
That's crazy.
Yeah.
Crazy.
So people will be drawing their own blood, putting it onto their phone, getting all kinds of things.
Yeah, I think you're going to see more of this stuff in the home and more actionable things. So whether it's the Scanadu device, which I might use, which is a small device which I can hold up to my forehead and will do a bunch of information about kind of where I am biometrically, right? At-home blood tests, even if it comes to me and I send them off, right? I'm going to be able to do more wherever I am, right? And the pricing needs to be transparent. Doctor licensure, like today, you moved within the state, but if you were on the East Coast and you moved from LA to San Francisco, you would have gone through 8 or 9 states. Yeah. The chance that your doctor has a license to be in that state, you got to find a new doctor, you got to do all this stuff. That's ridiculous, right? And so as we start moving through this process, you're going to have people at home able to do a level of diagnostic and information, caring for themselves and their loved ones, and then say, who's the best person to take care of me? I have this condition, who's the best? And I get to choose, and I get to, in a very consumer-oriented way, who's the best doctor?
And somebody will figure out and be able to rank who the best doctor is.
I think so. I think that it's going to be very subjective, right?
Like bedside manner as opposed to efficacy.
Yeah, I think that different people are going to choose differently. I think that's the challenge of a doctor.
Right, but efficacy, putting aside like, oh, you get along with the person, or you want somebody who's, part of your tribe kind of thing. Yeah. Which I guess is valid. But, like I might go for efficacy for me. Yeah. Like, I don't really care who you are. I just want to know I want to know you have the best batting average. Will we ever get to that point? Because And how do we get to that point? Because how do you judge the efficacy of knee surgeries and all this stuff?
I think what's going to happen is you're going to see this period of time where this is going to be like, it'll be our kids, it'll be it'll be their kids, right? Which I hesitate to even think about. That's right. And what will happen is that there'll be a lot more algorithmic work within healthcare. Here's what works. Here's what doesn't. We'll know a lot more about the genome. We'll know a lot more about how medicine's going to apply across different things. So a lot of times you're going to be saying, who's the doctor and what are the right treatments? But I bet within 10, maybe it's 20, maybe it's 30, you'll be looking more at what are the right treatments, what are the most effective treatments, not who are the best doctors, right?
Got it. So I am suffering from diabetes, whatever, and here is statistically, 1.7 million people did this for their diabetes, and this many people, had this result, and 3 million did this, and they had this result, and the data is just plain and out there.
Absolutely.
And then some algorithm is surfing that data and surfacing it, and eventually, do you believe, or at what point do you believe, an algorithm will be able to make a better decision than a doctor today? Not a doctor using the algorithm, but doctors today. Because, correct me if I'm wrong, but a lot of the problems we have in healthcare is, mistakes.
Absolutely. It's a huge problem, actually.
I mean, it's a double-digit problem, correct?
Absolutely. Oh, yeah, absolutely. And
septic shock and all this craziness that people
inside of hospitals, medical errors inside hospitals. You can't, imagine now telepresence with errors. You've got to be able to fix this problem. But I think what's going to happen, though, is you're going to take the role of the doctor is going to change somewhat. And that's honestly where I think personal health assistants are going, right? How do I translate? How do I understand? Is this choice right for me? I've got some more questions. And I never want an algorithm giving me bad news. So I'll give you personally, right?
Yeah, you don't want the algorithm being like, hey, by the way, you've got hepatitis.
I had a really personal example of this. So my healthcare provider, Palo Alto Medical Foundation, their EMR, they opened up the portal. They started letting us see our data.
Yeah.
And my urine test says on it, highly indicative of a tumor. That's right. Now, thank God it wasn't. But literally, I open up the webpage and that's what I see. I thought, that probably wasn't for me. Now, that algorithm was correct. Thank God I skirted around the 1%.
Yeah.
The algorithm was right. The data was right? So it's all going to be, how do we interpret? How do we share?
Yeah.
How do we walk through the emotional, like, tumor? Shit, right?
Yeah.
How do we walk through that process?
Right.
But the actual, is this a tumor? What should we look for? What are the other possible contradictions? What are the contraindications? What are the medications? There's too much knowledge in the world for one person to say, I remember back in med school, that spot means this. It doesn't make sense, right? Why, if I could tell you, for every person that clicks on one of our ads, what color their eyes are, why would I then say, but for healthcare, I hope that one person has all their thoughts in their brain? It makes no sense.
So in Los Angeles and also San Francisco, but I only became aware of it in Los Angeles, there is a family doctor thing. I got pitched on it. And it's like 25 or 50 dimes a year.
Yeah.
And you get your own doctor.
Yep.
They come to your house.
Yep.
I heard this. I was shocked. I was like, okay, so basically I'm going to buy my doctor a Prius every year, and then they will come to my house anytime they want. So they're going to come to the house 7 times a year. So it's cost $7,000 every time they come. I immediately do the math on everything. I'm cheap and I grew up poor, but I'm like, it's cost $3,000. But there are people paying 25 to 50 grand a year. Rich people pay. To have a doctor on call who comes to the house to take care of their families and give them whatever prescriptions they want. Well, how does that dovetail into what you're doing?
So that traditionally that's often called concierge medicine or concierge
medicine.
And so in a lot of ways, that's existed for a little while. And a lot of times as doctors I'm sick of the system, I'm sick of billing, I'm sick of insurance, right? Again, doctors want to do good by people. And I said, what's the best way for me to do good by people? Lower the number of people I have, raise the rate.
Yeah, let's have 30 families.
Right.
How many do they normally have a doctor like that?
Their panels, it's all over the map, right? But on average, you'll see like 50 to 100 sometimes. They keep busy, right? But they'll cap it at a certain amount, right? The problem is, again, that's one of those things where you're saying, well, if you can pay, right?
Yeah. It's an extraordinary number. It's basically what some people make a year.
Absolutely.
After tax, pre-tax, whatever. If it's a teacher who makes 50 grand a year, like they're going to make 35 after taxes. It's like they couldn't afford this.
Right.
If they give all their money.
Right. I think that, so that's one of our motivations, right?
Yeah.
Of like saying, look, look, I look at the world.
But what if you had better doctors?
Absolutely.
Like I'm talking about better branded doctors who I say, you know what, I don't want to pay $50,000 a year, but I will pay a little extra per month.
Absolutely.
And I'll pay, instead of paying $500 a year for my family, I want to pay $2,000 a year for my family.
Yep.
And I want it to include up to 2 visits a year.
Yep.
Is that something you could incorporate?
Absolutely. I think it's the type of thing that's like it's on the wall, on the roadmap.
It's one of the ideas.
It's absolutely. And when's the right time to also not step on the doctor's toes? Right now, remember how I went through the script when I call your doctor? That doctor's never threatened by us. Right? We're not going to replace him.
Yeah.
Right? He's still your doctor. We're helping him towards his cause, his or her cause. So we got to figure out the right ways to do that. If we just came out and said, we're replacing all the doctors, which some people have done, right? It's also commoditizing them, right? Because what a doctor's going to say is, wait, $50 for 15 minutes, I'm worth more than that, right?
Yeah, no, I don't want to commoditize them. I think what would be cool is if there was a better doctor available.
Yes, absolutely.
And they were available same day for this price and next day for this price or on schedule for this price. But they were just certified by you in a small area like the Bay Area.
Yep.
And, I could have them on call on a per item basis, and it would bill to my Better account, and it would be the record would be kept by Better, and I could kind of close the loop a little bit.
Yeah.
So I deal with my PHA for 95% of my requests, but I'm really concerned about my daughter. I really want a nurse practitioner. Or a doctor to come to the house, and I'm willing to pay $250 right now because I can't sleep knowing she's throwing up or whatever.
Yeah, it's funny. It's funny that you say that number too. I will admit that we have prototyped some stuff, and we actually talked about the "I need it now" button, and it's probably in that range, $200, $250.
Yeah.
You'll see that from us. I can't say when it's going to happen, but that's something we've been playing with and prototyping, and even for a first-time user who comes in an emergency or semi-emergency and says, this PHA thing sounds great, but can you do this for me right now?
Yeah.
Great, no problem.
Yeah, because I was in Vegas one time for the World Series of Poker.
Yeah.
And I feel a little tickle in my throat.
Yeah.
And I just know when I'm coming down with something, I'm like, oh, you know what, I've been here, and it's day 3. I'm like 3 days into the World Series.
Yeah.
Or I'm day 2, and I feel the tickle coming, and I just know when I'm going to get sick like that. So I just call the concierge at the Win, and they're like, oh yeah, we'll send up a doctor, no problem. It's going to be $200 or whatever. Doctor comes, boom. He's like, yeah, I'll just give you a Z-Pack. I have it with me.
Yeah.
And then the doctor goes like this, need anything else? And I was like, I love Vegas.
That's amazing.
So I said to him, I was like, yeah, I do actually.
Yeah.
I was like, I'm having a hard time sleeping. He's like, you want some Ambien? I was like, yeah, I'd love 10 Ambiens. He's like, great. I have 10 Ambiens with me. Boom, he gives me 10 Ambiens on the spot. I was like, God, you can get. And I think if I had said to the guy, I need OxyContin because my elbow hurts from playing cards all day, he would have given me 10 oxys. Like, I think it was like, the line was a little bit.
I think 10's table stakes, actually. But yeah.
So what? Yeah, see, I think that's the ultimate monetization. Wow.
Selling Oxy?
No.
No, I'm kidding.
Yes, that would be great. That would be the end of the company. But no, I just love the idea that I could just hit that on-demand button when I need it. Let me ask you a final question here about healthcare.
Yes.
Why don't companies like Google, because these guys are getting murdered in terms of the amount they're spending on stuff, right?
Yeah.
So if I'm Twitter or Uber or whatever, and I have, let's say, I don't know how many people a dentist could see in a dental practice, but they got to see everybody once a year. So if you saw 2 patients a day for 250 days, it would be 500.
Right, there you go.
So I'm just picking a number like that, 500 patients.
Yeah.
A dentist makes $1 million a year. I don't know how much they make or whatever, but why doesn't Google have 5 dentists on campus, give them stock options in Google. They work at the Google dental place with the latest equipment, and anybody who works for Google can go to the dentist, and you just say, we have catastrophic dental. If these guys can't handle it, whatever, we'll just pay for it out of pocket. But go see the person downstairs, just like they have meals.
Yeah, so Facebook and Google do.
What?
Yeah, so Facebook in particular, actually one of the people that works with us, she also works as a doctor at Facebook.
They have doctors on site? I never knew about that. Is that public knowledge?
It is now, I guess.
I guess so. No, but seriously, has anybody ever heard that before? Jackie, take a look, producer Jackie.
Yeah.
That's public knowledge.
It's and so they have and it's actually a third party. It's a company that they contract with.
Yeah. Is it that One Medical everybody can't shut up about?
It's not One Medical, but
what is One Medical?
Starting to do the same thing. They're kind of that concierge service. They're trying to figure out how to scale it
in a storefront.
But exactly, brick and mortar, right? And so there's still if you would say, like, I've jumped in the deep end of the pool with Better, we're going to sink or we're going to swim.
Right.
But we're going full digital, full telemedicine, full, like, they've kind of gone, they're in the same pool.
Yeah.
They're just at a different end, right?
Right.
It certainly probably feels more familiar to people, right?
It's sort of like going to a spa or something. They make it seem like you're going to get a massage.
They've done a great job.
Beautiful lobby, and you go and you see a doctor, but the appointment starts on time.
Yeah,
That's
same
their
day.
Isn't it like show something about the healthcare system? It's like, if you're marketing being on time, as the great, like, that's the great innovation.
I know.
Your appointment's going to start on time.
You get access to your medical records. It's on time. You can get an appointment the same day. It's like, you mean like my mechanic.
Yeah. So
like I dropped the car off.
You've reached the level of my barber.
Exactly. Well said.
Wow, great.
Yeah, I know.
Listen, I just want to say, Geoff, thank you for making a wonderful product in the world. Thanks for being a long-term super fan of the show and supporter. And I'm really thrilled with the product. I cannot say enough great things about it. I just insist that everybody who is hearing my voice right now, if you're a fan of the show, please just go download Better right now. Take a look at it. And if you really like, I can't imagine if you drink Starbucks once a month, or if you drink 2 Starbucks a month, or you go to the movies, or you have DirecTV or cable. Yeah. If you have any of those services, if you take an Uber, or you have Netflix, any of those two, or Starbucks, then you need to have this. It's the same price. Right. It's the same price as your goddamn Netflix and Uber bill, and just get it. It makes no sense. It's so amazing that this product didn't exist. There was nobody who had anything close to this, huh?
No, it was a new thing. It was funny because when we did it, there was still some doubt. I will tell you, like, look, history's great, right? It's like, we had this great idea. There was a time, I remember sitting in the boardroom at S&C and people going, you really sure about this? Is this the right thing?
The only thing I have doubts about is the price.
Sure.
I feel like it should cost triple. So I think if people get in now,
they better get in now before we
be grandfathered for a bit.
Oh yeah, for sure.
But it is if you're a single person for $20 a month to be able to talk to somebody about your health constantly. If you use it once a year, it's worth it. Twice a year, and forget about it. I mean, if it can just set your appointments up, that blocking and tackling,
saving the time,
the time is so worth it. It's such a great product.
Well, thank you.
And it's really like in the 1.0 or 2.0. What do you consider it now? 2.0?
Yeah, so it's really 1.0 at this point, 6 months out. And so we've only been live since April. We got a lot of stuff in the pipeline, but
it is just hey, and the Rock Health incubator, what do you think of that?
Oh, I mean, I love it. When I quit, I spent a good couple of years there just helping get that off the ground and working with the startups, and I can't say enough good things about it. It got me, that was like the third leg of getting me re-energized to go do startups again.
Oh, really?
Oh, yeah. I mean,
so it's This Week in Startups,
Rock Health, and Vaynerchuk's Tahoe Tech Talk. Those are the three things.
When did he do that Tahoe thing?
2010. So
I remember I got invited to that. Yeah. I couldn't make it, but
it was one of those things where it was like 100 people, and I was like, I just sold the company, and or a couple of years selling the company, and I was still there, and I was like, what's next for me? And you're like, this is my tribe. And the next day, quit. Like, I got to go. I don't know what it is, but I got to find something new. So
awesome. Yeah. Well, congratulations.
Thank you very much.
To the team over there. Great job. And wow, getting the Mayo Clinic involved, that must have been hard.
You know,
or not, I don't know.
Well, they're LPs with social capital, and they had some ideas, and Chamath had some ideas, and I had some ideas, and it was basically the first couple months were tough, getting around the same page. A big company, big healthcare, and telling them, we love you guys, and we love what you do, but 10 years from now, if you want to exist, right? But there's some really innovative people over there that are kind of leading the charge, and even their CEO, because we're at the CEO level with who we're working with. You know, they're trying to reach 200 million people by 2020. They have this really big goal, and they can't do it with a physical building in Minnesota, right? They can't do it with this campus in Minnesota. They know.
Are they a nonprofit, Mayo Clinic?
Yeah.
So it's a huge nonprofit.
Huge nonprofit. They have 3 main clinics in the United States: Arizona, Minnesota, Florida. And what they did is they know they've got to extend. That's why the Apple partnership happened on HealthKit. They are saying, look, we're this. And they are. I'm going to say it for them. They'd never be this. They've been much more humble than this. They're this amazing, best in the world. When presidents get sick, when princes get sick, they fly to Mayo, right? Well, how do you get that knowledge out of those buildings and into everybody's pocket? They're smart enough to know we're the experts. You guys are the mobile experts. Let's work together and figure this out.
It's kind of like Harvard or MIT or Stanford, where it's like, wow, yeah, we have the greatest program in the world, or we think we do.
Yeah.
How do we get it to more people? And you have Coursera and other people just helping them do that. Like, we'll help you get these words out. All right,
Great analogy.
Amazing show. And everybody go to getbetter.com, or search for Better in the healthcare section of the iOS or soon Android store. And you can follow Better on Twitter, BetterPHA. And I'm at Jason. We'll see you next time on This Week in Startups. Bye-bye.